The latest on the deadliest food poisoning outbreak in 13 years. This morning, officials say at least 13 people have now died of listeria from eating contaminated cantaloupe. The Centers for Disease Control say that 72 people in 18 states have gotten sick and expect that number to go up.
Jensen Farms in Holly, Colorado, the source of the outbreak, has already recalled millions of cantaloupes, and that happened earlier this month. Let's bring in now medical correspondent Dr. Jennifer Ashton. So as we mentioned, Jen, one of the things that's troubling for a lot of people, and I would guess alerting a lot of concern at the CDC, is that this did happen a while ago.
Right.
The death toll, though, has more than doubled since last week. Explain to us how this all works out.
Well, it's not uncommon, Erica, at all to see a lag time between a recall, a product recall, in this case the cantaloupes, and rising cases, in this case, unfortunately, deaths. Because, number one, this is a bacteria that can live for a long time in refrigerators, on surfaces. Even though the recall occurred a couple of weeks ago, it also has a long incubation period, up to 4 weeks. So people could have eaten cantaloupe, still feel fine, but they will continue to get sick in the future. The other thing is the clinical course of the disease takes time. People might have been sick last week and unfortunately died now. And then finally, it takes time to do laboratory confirmation testing. So unfortunately, the CDC does expect the death toll potentially to continue to rise.
Is this the most deadly of foodborne illnesses?
Well, for listeria, yes, Chris, and we have to put this into context. Unfortunately, 1 out of 6 Americans is affected with a foodborne illness in this country every year, and there are 3,000 deaths. That is way too many. So this is something that for this particular bacteria, it does appear to be a more deadly type of bacteria than something like E. coli or salmonella that we hear about a lot more often. So this is something that the CDC is keeping a very close eye on.
And it seems, though, the CDC is keeping a close eye on this, but it feels like we're hearing about a lot more outbreaks.
We are, and you know what? The tracking abilities are better, and that's something that the federal government is trying to implement greater oversight over. We'll be hearing more about those regulations in 2012. For this particular outbreak, the people at greatest risk, the elderly, pregnant women, people with a weakened immune system, be particularly careful.
As always, Jen, thanks.
You bet.